Are you hearing the clip?
Yes. Welcome to another episode of Mind Health Matter, a place to discuss our mental health as Caribbean people. We are your hosts, Flavia D'Souza
and Kimberly Homishashek.
And we are so pleased to have Dr. Lovern Moseley joining us again this week. As a reminder, she is a phenomenal licensed psychologist with over 25 years of experience in the mental health field with children, adolescents, and adults. She's currently on staff in the Division of Child and Adolescent Psychiatry at Boston Medical Center and is the site training director for the Boston University School of Medicine Mental Health Counseling Program and clinical assistant professor in the Department of Psychiatry at that same place. Dr. Moseley is also the CEO of Empowerment Counseling and Psychotherapy Center, a thriving group practice with locations in Massachusetts and in Rhode Island. Dr. Moseley has worked extensively with parents and children struggling with emotional and behavioral disorders and those with traumatic exposures, including abuse, neglect, abandonment, and management of issues related to grief and loss. She has experience in evidence-based treatments for post-traumatic stress disorder, including trauma-focused cognitive behavioral therapy and treatment of traumatic grief, depression, anxiety, ADHD, and post-traumatic and oppositional defiant disorder. Dr. Moseley specializes in Christian counseling, marriage and family therapy, including work with issues around transition to adulthood and career concerns. Dr. Moseley completed her pastoral psychology fellowship in the Department of Child and Adolescent Psychiatry at Boston Medical Center. She earned her doctorate in counseling psychology at Temple University and her master's degree in human services psychology at LaSalle University. Thank you so much for joining us again, Dr. Moseley.
Thank you so much for having me back.
Yes, Dr. Moseley, it's great to have you back. And given your range of experience in trauma, I was wondering today if you could give our viewers a quick definition of trauma, signs and symptoms in children and adults, and also maybe talk a little bit about perhaps how the migration experience ties in to trauma as well.
Okay, yeah, so trauma can be defined as, an exposure to, an actual or threatened, event, right? A threatened death or serious injury. There could be like sexual violence. So like you can directly experience some kind of trauma. There could be natural disasters that individuals may experience. There could be some way that a person may experience. There could be significant individuals who may have gone through like pregnancy loss, or they may have gone through some kind of sexual assault or experienced some significant medical illness, that makes it very difficult for them to continue to function regularly in their lives. It's like, in more lay terms, like it gives a jolt to their system, right? And so there are individuals who may have gone through like chronic trauma, where they've experienced multiple things over and over and over again in their in their lifetime. Now, in terms of the kinds of things that people experience when they've experienced a trauma, they could have difficulty with, constant feeling like they're reliving the experience. So they may find themselves, having these, these trauma, responses or reactions. If they have like a deja vu kind of moment, feeling like they're back there again, experiencing it. It's something that, the term of the post traumatic stress was something that was seen like after someone experienced a war, right? So like those who have been in war-torn areas or have, been in combat, they feel that they're back in that experience again. And that can also happen with other very significant traumatic exposures that people have. And so we would see where there may be flashbacks, or with kids, they may have nightmares. They may not know specific what the nightmares are about, but they're now having disrupted sleep. When we work with children, we also see like a lot of reenactment of the trauma that they may have experienced. So in their play, they may be, reenact the events that took place. I had a child that I worked with for many years who had lived in a situation where there was a lot of domestic violence that he experienced, and the family had to move often. And so a lot of his play was centered around this packing up experience, and then there was a lot of, like disruption even in the play, and a lot of banging and throwing things. So we'll see that a lot with children. In adults, we also see like numbing that will happen. You feel like you're not able to really experience any kind of emotion, but it's a significant shift from what your response may have been pre-trauma. A lot of individuals now, we're experiencing this collective trauma, with what's going on with COVID right now. Within the Caribbean in particular, I would say, because I'm originally from the Bahamas, the most recent, prior to COVID, traumatic experience that happened in that country was Hurricane Dorian, where families were torn apart, lives were lost. So that was like a community, type natural disaster that they experienced that, was very overwhelming for a lot of individuals. When we also think about, as you mentioned, Kimberly had mentioned about migration, for individuals who may have left, their countries, and not even just from the Caribbean, but even individuals who may have left. When we think about migrations that are even happening now from Central America, individuals who are trying to escape, community violence, gang violence there, incidents of abuse. It's, when they now arrive into a country that they're hoping is going to provide some relief, and then they're turned away, it's like a continual re-traumatization that they're experiencing, once they, end up being detained or even sent back when they were trying to set out looking for hope. And so, it's a very significant, public health issue when individuals are experiencing traumatic experiences that are happening over and over and over again. And so it's something that really needs a lot of attention as we think about, do we then provide the support that's necessary for them to be able to move past what it is that they have been experiencing. One thing that we talk a lot about in trauma work is resilience. So it's like, how do we get to that space? How do we build on the strengths, after going through something that's so traumatic?
One of the questions that we are getting here is, why might some individuals have these kinds of responses to trauma and others do not? Before you get into that question, just to kind of reiterate what you're saying, it sounds like trauma is a significant psychological injury that leads to impairment in functioning and a certain degree of distress. And oftentimes the traumatic experiences that you have highlighted seem to be quite repetitive or ongoing. For example, you talked about being in war, but here in the Caribbean, you talked about Hurricane Dorian, talked about trying to migrate, especially if it's in the context of moving from a place of conflict or moving to a safe place and then being turned back. And then also the ongoing difficulties dealing with constant death in the COVID pandemic. So just kind of back to that question, why is it that some individuals may display symptoms or may be impacted by the trauma and others aren't?
So this is a thing that really comes down to individuality. All right, that we're all individual people, and so our experiences, while we may have a collective traumatic experience, we each view the world differently, right? So it's what internal schema that we may have allows us to see how we are going to respond or act on the world. when we find ourselves in certain situations. Some of that now, like as I mentioned about resilience, some of that can be built in, or it's like that internal drive that we may have to say, yes, I'm a survivor. I'm going to, survive this happened. We have a different mindset, a different way of thinking about the traumatic event that allows us to be able to still, move past it or work through it in a different way. There are some individuals where, they may go through a traumatic event and what they need is just access to resources, and once that they're able to get running and rebuild, right, and restart their lives in certain circumstances and situations. But it's the access to, and those resources can also be, the coping skills that they may draw upon from their past, or things that they may learn while they're in some kind of treatment, with a skilled professional.
Mm-hmm. Yes, thank you so much, Dr. Moseley. So to recap again, and just even to simplify things a little bit more in terms of trauma being a psychological injury that disrupts areas of functioning, to simplify it even more for listeners, it's this event that happens to you, an adverse event that left you overwhelmed and unable to cope, unable to deploy the normal ways that you're able to alleviate stress and anxiety. And it changes the way we think, the way we feel in our bodies, and the things that we do. And I think, Dr. Moseley, you highlighted nicely that there's different predictors of trauma recovery that can be on the individual level, which are things like the child's developmental level and age. It could be ethnicity factors. It could be family factors, level of stress in the family, ongoing life stressors. It could be community level, what factors in terms of safety, violence, poverty. It could be psychiatric comorbidities. So all these things can interact and predict one's resilience, so to speak, for trauma. And then if we think about trauma sort of you're not able to have the tools to cope in terms of the migration experience, when you have this loss of country, loss of identity, loss of the proper tools that you need to cope in the environment, it's, migration itself could be sort of, characterized as a trauma. So maybe you could share with listeners if you have any guidance for immigrants, or specifically Caribbean immigrants coming to the U.S. What can they do, and what should they do perhaps shortly after arriving? What can help them overcome any trauma that they might be experiencing, or the context that they were coming from?
So around community, right? So for a lot of Caribbean individuals who are coming into the country, or even, other foreign nationals that may come into the country, you will see that there are certain pockets within certain towns where, where people are connecting to each other. So that community, being able to be around people who look like you, speak like you, eat the same foods, are able to share some of the same experiences, that can help to mitigate some of that trauma, right? So it's important to, to figure out, where is my community going to be? Am I going to find those pockets of people that can provide support? Another very huge piece is being able to draw on your spirituality, being able to draw on, the church resources, to be able to provide even additional support, right? So if you were part of a particular denomination or religion, being able to connect, with that particular church is something that's going to be important as well, to help you to navigate, where do I need to go, or who do I need to talk to once I arrive, right? So that can at least be a stepping stone. Being able to, still stand on your feet, and to have that continued strength is hugely important for being able to manage the effects of a trauma that you may have experienced, right? So we want to look at, who is my support system? Where's my community? How do I build new community? And the other big piece, which is something that I think that a lot of us are seeing so much now, is being able to recognize that we have to move away from the stigma of seeking mental health support, right? So being able to reach out, if first it's to a primary care doctor to say, like, I need to have someone to speak with, to be able to help me through, a lot of, these symptoms that I'm having that feel really strange within my body. I'm not sleeping. I'm not eating I'm having headaches. They're physiological things that are happening. There are certain, you may encounter someone that reminds you of, a trauma that you may have experienced, and you don't know why is this overwhelming feeling of fear or wanting to run or wanting to flee, right? And so it's impacting so many areas of your life, that you just don't feel settled. And so it's important to be able to connect with a professional that can help you figure out, how do I sort this stuff? How do I make sense of this? How do I get back who I know is me? Right? So you want to be able to know that there's nothing wrong with going to seek help. And it doesn't mean, we have this, this saying, you must be crazy, you must be mad, no, you have to take hold of your own health and your own healing. All right. And when you see something, even if you're thinking about your children, you see something that also looks like, oh, this is not just something's odd or something seems off. Talk with your child's pediatrician. Get a referral for behavioral health. Be open to being a part of that treatment, because the healing that's going to happen if there was something that occurred to your child or even occurred for your family is being able to be open to talk about it. Holding on to it and not talking about it won't make it worse. It causes those symptoms to. So we want those symptoms to, to be able to be addressed. We want you to be able to be successful, in moving forward with the goals that you had in coming to this country, or with other endeavors that you have that you're trying to achieve. So make sure that you seek help. Don't be afraid to do it, and don't worry about what other people are going to think, because you're the one who's having to live with the symptoms that you're experiencing.
Yeah, I'm going to just reiterate some of those points because I think they're so important. We're three mental health professionals here, and we do care about our patients. Also, you are chipping out a little bit, so I was able to catch maybe about 99% of what you said. One, I think, we have this framework, which is a negative way of framing things, that something must be wrong to seek help. I would kind of flip that on its head and say something is right in seeking help. It's a normal part of taking care of ourselves and self-care to seek help. And that may include just a little mental health checkup that you do ever so often. The second thing is that you said so beautifully is that we really want our patients or clients to live their best lives. And if there's something that's getting in the way of that living their best life, that may be improved because with an intervention that we may be able to offer, whether it's talk treatment or whether it's medication, we are happy to do so to get individuals back on the track of living their best lives. One of the things that I encounter, because you talked a little bit about symptoms in my practice, is that trauma symptoms can mimic symptoms from other psychiatric illness, which is why it's good to have a professional getting involved if you're starting to have any kind of symptoms. I'm wondering, what have you seen, especially in children, what trauma symptoms look like and what might it be mistaken for, and how to make that differentiation in the child?
So it's always very important to, gather a history, right? Your child, how they're responding. Now, all of a sudden, we are seeing things like bedwetting, or we are seeing, increased irritability, right, in the child, that their behavioral problems that they're having, or they seem more fearful. Okay. Or that they don't want to go certain places or be around certain people, or nighttime makes them feel afraid, especially for those who may have gone through a natural disaster. Say that, something, there was a, the hurricane, in terms of, how dark it was, sounds of the rushing loud sounds are also bothering them. When you start noticing some of these things, or you're noticing that there's like repetitiveness in their behavior, and it seems like there's more, aggressive play, as you're noticing them, you want to pay attention to those things, because that's a shift or something that's different from how they had operated in the past, right? And you want to start out even just with talking with them about how they're feeling. Okay. And recognizing that, yes, some of these things that may seem like, oh, they're just acting up, or they're just not, listening, or you see also a decline in their school functioning. Here it is, a child who had probably always done well, and now all of a sudden it seems that certain abilities have declined. You want to pay attention to that as well, and try to, at least first maybe speak with, their teachers about a referral, or even with their primary care, their pediatrician, about a referral to a behavioral health specialist who will be able to, do a proper assessment about what may be going on, to at least get to the bottom of what, the child may be experiencing. But you don't want to ignore it. You don't want to neglect it. You don't want to, feel like, oh, they just need more discipline there, because there may be something else, that's, that's going on, that you want to pay attention to. Anytime there's a shift from a previous level of functioning, we pay attention to those things. And especially in children, children don't necessarily come out and say that they're sad, or that they're afraid, or that, they're not going to tell you necessarily that something, horrible has happened. They're going to show it through their behavior. They're going to show it through their interactions on a day-to-day basis. So pay attention to the children.
I think you're muted, Kimberly.
Sorry about that. Thank you very much. It sounded like you were mentioning a lot of behavioral symptoms like defiance and aggression and irritability, and some ADHD-like symptoms, inattention. Can you share a little bit about, and it sounds like you said that a developmental history is good so that you can pinpoint when the shift in things happen. How do you go? Can you share with viewers and for those who are parents out there, how can they know that this is not just them being stubborn and a bad child, and that something has happened to them rather than what's wrong with them? Why aren't they listening?
Yes. So even if parents are able to recognize, because a lot of times when we're taking that history, we're looking at, what could those vulnerabilities be? What could those instances have been that may have caused a shift? And a lot of times families make a lot of moves, and, they don't necessarily think about how this is impacting the child. Right. So you want to, when we're doing a history, when we're gathering this information, we're looking at, have there been multiple school moves? Were there, difficulties, maybe, during your pregnancy, right? That could be contributory. When we think about biological vulnerability, are there genetic things that are going on, right? Is there a parent who may have been struggling themselves with, symptoms of anxiety or depression or ADHD, or the whole family collectively has gone through a trauma? Did anyone pay attention to how this impacted the child? Because a lot of times as adults, it's like, okay, we're going to, pull it together and keep moving. And no one necessarily looks at what the effect or the impact may have been. So we want to know, what changed? What happened differently? Was there, did the child go to a school? Was there a different caretaker? Even as I think back on my own history, because of the kind of work that my dad did, we lived between the Bahamas and Florida for many years as I was growing up until probably 7th grade. So it was like every 2 years there was a shift in countries, right? So we were either living in the Bahamas or we were living in Florida. And, I have to, speak to that, the resilience, right? That is, it seems like maybe it was something that was innate, because when I think of my parents, they're very resilient people. They help to bolster and support me and with these shifts. And there were conversations about, the next move. So there was that, opportunity to be able to, talk about it, to try to understand what was really going on. And it doesn't mean that it's always going to be easy, but it's important to have that open line of communication with your child so that they can now also understand, that this is something that's, essential, that we have to move either for safety or for work. Yes, there's an acknowledgement that there's going to be, loss in terms of friends and the routines and things that they're used to, but, this is the reason for, the shift or the move. So you want to look at, what's changed, because sometimes you may think it's minuscule, but it could be something. I had another child that I was working with. The parents were trying to understand, why are we now seeing like an uptick in, negative behavior, or that the child is being really short, right? Now, he was a kid who really struggled to make friends, and the neighbors that he had, for a few years and had gotten comfortable with had moved away. And so he was missing them. And so was struggling, with that loss. And so the parents, didn't really pay attention to, the impact of that, special friendship that he had, with the other neighbors. And so they missed, the child was acting up. They weren't sure what was really going on. So like we said, there are a lot of behaviors that mimic, other disorders. When we think about depression, anxiety, traumatic exposure, ADHD, these are also things that can be better, right? So if you know that there are struggles that you have, if there's an anxious parent, a lot of times we're going to see an anxious child. So you want to pay attention to that too. It's also, what you are teaching at home in terms of how you handle stress or how you handle difficult situations. That's really important to pay attention to.
Right. I think that's really a critical point, because the talking about the event before it happens does a couple different things. It makes the child aware, but it also models that it's okay to talk about things. That's something that you just mentioned in terms of how it is that we manage stress in our lives. It's something that we can show as well as that we can do through talking about it with those individuals who are in our lives. I just want to very quickly say that in the same way that symptoms may present in children that might not seem like they're trauma symptoms, but they are, that we have in adult patients and adult persons who experience trauma, they may have what, and you mentioned this before, kind of re-experiencing symptoms that seem to be so real that they are transported back into the trauma. They may have mood symptoms. They may feel an overwhelming sense of guilt. They may feel sadness, experience irritability. I've also had patients who feel quite paranoid because they're afraid of the trauma happening to them again. And so these are all symptoms that may be confused for another kind of psychiatric illness, but may be related to a trauma that a person has experienced. Now, I know that you have done some work around COVID, and we're getting a question here around what it is that you've seen as it relates to trauma and COVID, and just to hear some of the work that you've done with that in that area.
Of COVID right now, this is a global pandemic that we're experiencing. So there's there's a collective response around this trauma, and even though the death and the loss is something that has been so paramount and so difficult to manage, at least there is something around we're going through this together, we're working through this together. In some of the work that I've done, or other talks that I've done, it's around helping children who have also had to struggle with remote learning in different parts of the world, and just what that has looked like, and the fear that they have had about leaving and going outside, the fear of turning to school, fear of grandparents or their parents getting ill, and so we've seen also an increase in anxiety symptoms around that, and also kids who were refusing to even to school, or had a lot of fear around that. And so a lot of the work help kids feel safe the time to get back. The other piece was also looking at the primary caregivers, right? Doctors who were in the hospital as part of an initiative that was done with Boston Medical Center. Our behavioral health department were able to, provide, like on the fly, support, mental health support for the emergency room doctors and nurses that made some support because of what they were seeing at the time. And so I was, also part of that team, to help to provide that support. In the Bahamas, we also, there was the same thing that was happening there as well. I had the privilege of being able to do a talk with a lot of the doctors and nurses there around ways that they can manage this stress, in terms of the work, and to be able to provide a space to talk through what the experience has been like for them. Because even those that camaraderie and collectivism around, we're going through this thing together, there was still a lot of fear that was expressed, by the medical professionals. And I remember one doctor in particular who, shared that there were feelings that she had of grief and fear around bringing the virus home to her children, and how does she keep her family safe? And so that's something that a lot of people have been walking around with. And I think as we're able to kind of breathe a little bit more, we have to still look at, how do we now take the time to heal ourselves through this process, and know that there's some normalcy to, these symptoms and things that we've been experiencing. I think that that's the piece that's, that's really imperative, that we understand that, like what you're feeling is real, and, and it's normal, that anyone who is going through something like this probably also struggle with very similar feelings, in terms of how you respond to it will be different. But that doesn't mean that, it's wrong that you feel sad, or wrong that you feel guilt, or wrong that there's anger that you have. I mean, even, some people, are even struggling in terms of their faith and their spirituality around, why would something like this happen? But being able to talk about it, being able to find that safe space to do so, is the thing that's going to help to bring the healing. So the response that I got, even after some of the talks that I've done around, how to cope through this process, is that it was really helpful to be able to have a space to talk about it and to remove that stigma, because a lot of people are walking around feeling like, I'm supposed to be strong, I'm supposed to be able to handle this. But, one thing that we've been hearing a lot of lately is that it's okay to not be okay, and so with that being said, if you're not okay, if you're not feeling okay, go and do a checkup. Go in. It doesn't mean because you go in to see a therapist that you're going to, be in treatment for the rest of your life. There are individuals that I've seen where, it could be they're coming in, 3-4 sessions, but make the step, because you don't have to go through this alone.
I like to call those booster sessions.
Yes. Absolutely.
So where can people we're approaching the end of our time. Where can people find you?
So I have my private practice, Empowerment Counseling and Psychotherapy Center. And so the website there is www.empowermentcpc.com. And I'm also still practicing at Boston Medical Center in our child and adolescent psychiatry department. And so there it's be.org. You're able to, locate that, pretty easily. And those are the places that you can find me.
Thank you so much for joining us again today. And so we're going to just wrap up our show. Thank you all to our viewers for joining us again for another episode of Mind Health Matter. As a reminder, we are on every first and third Wednesday at 7:30 p.m. Eastern Standard Time. Live. We're usually on Facebook. We weren't on Facebook Live today, but we are on usually Facebook Live, YouTube Live on Island Fever FM. radio station. Tell us what you want to hear about. You can leave it in your comments. You can send us questions on Twitter. We would love to respond to your needs. Until next time, remember that your mind health matters.